Hello there, ladies and gentlemen. This is David T. Kramer, and today I'm going to talk a little bit about CBT, or cognitive behavioral therapy. What is cognitive behavioral therapy? What is depression? If I think I'm having a mood disorder, what can I do in addition to seeking out professional help? The Diagnostic and Statistical Manual of Mental Disorders lists up criteria for the diagnosis of depression. A psychologist will look for 5 or more of the following for the same 2-week period. 2 of these are absolutely necessary: depressed mood every day, nearly all day, and diminished interest and pleasure in activities. In addition to those 2, 3 others will be necessary to show up during the same 2-week period. For example, significant change in body weight, could be up or down. Insomnia, can't sleep, can't go to sleep, can't stay asleep, not sleeping enough. Or hypersomnia, sleeping too much, sleeping all the time. Psychomotor agitation or retardation. Loss of energy, reduced ability to concentrate and make decisions. Recurrent thoughts of death. And also, the symptoms are causing the individual to experience distress, or they are impairing his or her ability to function in daily activities. So, 5 or more of these listed up here over the same 2-week period, and feeling distress or unable to function properly. These are what a psychologist will look for in terms of diagnosing clinical depression. In looking at the philosophical grounding for cognitive behavioral therapy, I like to consult Ayn Rand and her objectivist approach. I really think these two work together nicely. That is, objectivism and cognitive behavioral therapy. And Ayn Rand says that everybody is conscious of what exists, and everybody has an identity, as does all that exists. So I am conscious of what exists, and I have an identity, as does all that exists. So existence exists. Using introspection, we recognize that our emotions exist, that they are internal existence. And using introspection, we can answer the question of, what am I feeling? Am I feeling bad? What is the identity of what I'm feeling, we might say. And then we might ask ourselves, why am I feeling the way that I'm feeling? Ayn Rand believes that our subconscious is like a computer, and that it is more complex a computer than what humans can build. And its main function is the integration of our ideas. Who programs our computer? Well, we do. You program your computer with your conscious mind. And Ayn Rand says if you default and you don't reach any firm convictions, then your subconscious is being programmed by chance. And you deliver yourself into the power of ideas you do not know that you have accepted. And so how do we find out what ideas are, what thoughts are that we have accepted, that we don't even know we have accepted? Well, through introspection, we begin to find that out. But Ayn Rand says, whether you know the ideas that you have accepted or not, you are going to get a computer printout daily and hourly in the form of emotions, which are lightning-like estimates of the things around you, calculated according to your values. So the subconscious mind is going to interpret your experience and give you an emotional readout, whether you know how you are interpreting reality or not, so to speak. So we could say that our feelings are real, they are real existence, but on the other hand, they are not really facts about the external existence. In other words, they are not really facts about what we are experiencing. They are printouts from the subconscious mind. And so, even though the emotions exist, they are internal existence, they really are not facts about that which exists. Feelings are not facts about that which exists. Feelings are, rather than being facts about that which exists, they are effects. If you think about cause and effect relationship, feelings are the effects caused by the thoughts that one has about that which exists. For example, if I tell myself that I'm brilliant, that thought will likely cause me to feel happy. On the other hand, if I tell myself if I think I'm an idiot, then I'm probably not going to feel very happy at all. So, feelings are effects caused by the thoughts that one has about that which exists. Now, David Burns, working at the University of Pennsylvania as a clinical psychiatrist, identified 10 automatic thought distortions. And I think this concept of automatic thoughts works very nicely with Ayn Rand's concept of a subconscious. Because we are continuously interpreting our experience, interpreting existence at a subconscious level. And so when Burns says that these thoughts are automatic, it's like we don't even know we're doing it. We just automatically do these things. And he identified 10 automatic subconscious or automatic thought distortions that a person has when he or she is depressed or anxious. And so when a person is depressed or anxious, the mood is the result, we could say, of subconsciously thinking about existence with irrational or distorted thoughts. And Burns came to identify 10 automatic thought distortions. Here's a photograph of David Burns. Now, he wrote a book. His book is titled Feeling Good, the New Mood Therapy. And at the University of Alabama, they did some research, and they came up with the concept of bibliotherapy. And so they took 80 individuals who had come into their clinic at the University of Alabama, and they gave these people the Beck Depression Inventory, and they were found to be moderate to severely depressed. They had clinical depression, but they told the people, because it was, I assume, actually true, that they could not treat them right now. And instead, what they did was they gave the people this book and said, take this book, go home and read it, come back in 4 weeks, and we can meet with you and start psychotherapy. So, and actually, 40 of the people got the book, and 40 other people did not get the book. And so, after 4 weeks, the people who got the bibliotherapy, represented by the red bar on this bar graph, when they came back 4 weeks later and they were tested with the Beck Depression Inventory, their mood had moved into a normal range. The control group, who did not get the book, when they were tested 4 weeks later, they had actually shown a bit of improvement, but not nearly as much improvement as the people who got the book. So they gave them the book 4 weeks later, said, read this book, come back in 4 weeks. And sure enough, when they came back, their mood had gone into the normal range. So they sort of coined this term bibliotherapy. Psychotherapy from reading a book. And really what this demonstrates is that a person can pretty quickly reprogram the subconscious mind using proven techniques, because David Burns has in this book a description of these automatic cognitive distortions, but then he also has techniques that can help you reprogram the subconscious mind. And we're going to talk about at least one of those techniques here in just a little bit. But before we do that, let's talk about the 10 cognitive distortions that Burns identified in his patients in his clinic. This is a quote from Burns. He says, "You pick out a single negative detail and dwell on it exclusively so that your vision of all reality becomes darkened like the drop of ink that colors the entire glass of water." So imagine as you're making your way through the day and you notice something that is a bit negative, and you dwell on that. And then the rest of the day you experience the whole day as negative because you're filtering your experience through that single negative detail, whatever that might be. It could be something small, like bird crap on your windshield, or it could be something more serious. But the point here is that by dwelling on that negative detail, like maybe something silly like you have a pimple on your face or something, your vision of all the rest of the day, your vision of all reality is darkened. So you're filtering your experience through this one negative detail, a negative experience of some sort. Another one of Burns' automatic thought distortions that he identified in his people was simply emotional reasoning. We said that emotions are not facts about reality, but sometimes we take our emotions as evidence for the truth, and we let our negative feelings guide the way that we act. So maybe I feel guilty, and because I'm feeling guilty, I think to myself, I really am guilty of something. I experience unearned guilt, we might say. Well, I must have done something wrong because I feel guilty. I feel inadequate, so I must actually be inadequate. I must be worthless. I feel hopeless, therefore my problems cannot be solved. I'm not in the mood, so I'm not going to do anything. I feel like a dud, so I am a dud. So in other words, I distort truth, I distort reality by using my emotions as evidence. Emotional reasoning. This is one of Burns' 10 cognitive distortions, emotional reasoning. And think about this. Somebody who's doing this doesn't even realize that they're doing it. In other words, this is an automatic, subconscious interpretation of the world through emotions, and the person is not really aware that that's what they're doing. Should statements occur when the individual whips himself with shoulds, shouldn'ts, musts, and oughts. And this can cause the person to not like themselves, cause the person to feel shame and guilt. And if you think about applying shoulds and oughts and musts and shouldn'ts to other people, it's going to cause you to feel frustration and resentment towards those other people. So should statements are another example of an automatic distortion of reality. Overgeneralization, similar to a mental filter. You see a single negative event as a never-ending pattern of defeat. For example, if you fail a test in school, you say, I'll never, ever be able to pass this course. I'll never, ever pass another test. My whole life is ruined. I'm overgeneralizing from this single negative event to the rest of my life, to the rest of my experience, to the rest of existence. Labeling is when you attach a negative label to yourself, or maybe to others. If you attach it to others, then you get anger and resentment. If you attach it to yourself, then you are doing an extreme version of overgeneralization. For example, you say to yourself, I'm a loser. I didn't pass the test, therefore I'm a loser. Instead of saying, hey, it's just one damn test. And why did the teacher put those questions on there? Another cognitive distortion, disqualifying the positive. You reject your positive experiences by insisting that they don't count for some reason or another. Oh, wow. 4 years, I got my degree. Congratulations, nice job. And the person's thinking, boy, I really fooled these people, didn't I? This really doesn't count. This is nothing. The binocular trick, or we could say magnification, is when you take the binoculars and you're looking at something good, maybe one of your strengths, and you turn the binoculars around the opposite direction and your strengths become small. You minimize your strengths, so to speak, and then maximize your weaknesses. Minimization, magnification. All or nothing thinking. Evaluate situations as black or white with no shades of gray. A student told herself that she didn't get an A, she only got a B, so that was failure. Personalization or self-blame occurs when the individual says that something is their fault, which is really not their fault. In other words, they take responsibility for events which they have no control over whatsoever. Jumping to conclusions, typically a person will make a negative interpretation even though there's no definite facts to support the conjecture. A lot of times this would be fortune teller error, where they say, oh my God, I'm going to mess this up. Or mind reading, where they imagine that they can read other people's minds and typically imagine that other people are thinking negative thoughts about the individual. Now, Burns has developed probably at least 50 different techniques that the individual can use to reprogram the subconscious mind. One of these is called the triple column technique, where the individual draws on a piece of paper, makes 2 lines, creates 3 columns on the paper, and just asks himself, what am I thinking right now? I feel bad. What am I thinking? What was the event that I'm thinking about that triggered me to feel bad? What am I telling myself about this event? And then in the second column, identify what the automatic thought distortion is contained in that thought that the person wrote down in the first column, and then write a rational response to that. And that's very important, to write that rational response. And so Burns would have somebody do this maybe 15 minutes every day, 15 to 30 minutes every day. Take time to do the triple column technique, or anytime the person feels an especially exaggerated mood. Another technique that Burns used is called a pleasure predicting sheet, where you write down what you think you're going to, how much pleasure you will get if you actually go ahead and go do something. Because a lot of times when somebody's depressed, they won't get out and do anything. They won't even maybe they need to do laundry and they don't want to do laundry. Or maybe they need to wash dishes and they don't want to wash dishes. And Burns makes the argument that motivation typically follows from some action. So he says, write down how much pleasure you think you'll get from washing the dishes. And predict, from on a scale of 1 to 10, how much pleasure will I get by doing the dishes and having a clean sink, a clean kitchen. And start taking action and find out that, motivation follows action. And then when you're done, write down on a scale of 1 to 10 how much pleasure you actually do get from this activity, whatever the activity is. And then another technique that Burns uses he calls it mental feedback. And the idea here is that you count the number of automatic thought distortions that you recognize as you make your way through the day. And then you write that down every evening before you go to bed. Typically, what Burns would use is a golf counter. You can count your strokes with a wrist golf counter. And so every time you notice one of these thought distortions, you click that. And typically what will happen is the individual will, if they chart this day after day after day, for the first couple of weeks, they get more and more and more and more and more. And then it starts to go down automatically because there's just something about getting the feedback on that, recognizing that, doing that instantaneous introspection, getting that mental feedback that permits the individual to retrain, to reprogram the subconscious mind. Let's take a case study here. Nancy, a 34-year-old mother. Nancy's divorced and remarried. She's a part-time college student. She's experienced some episodes of depression, and she becomes very self-critical when she's depressed, as people do. She sunk into a depression when she received a note from her son's teacher stating he was having some difficulty in school. She began to mope and personalize the situation, blame herself. So in expressing her thoughts, what she was thinking to her therapist, she said, "I should have worked more with Bobby on his homework. Now he is disorganized and really not ready for middle school. His teacher told me that he lacks self-confidence and he doesn't follow directions. This proves I'm a bad mother. A good mother spends more time with her children every night. Bobby has been lying and not doing well in school, and it's my fault. Bobby's life is ruined. He is destined to a miserable life." And I think with just a little bit of reflection, you can see some of the automatic thought distortions that Nancy is experiencing here. Should. Already she's got a should statement here. I should have worked more with Bobby on his homework. Well, how much should a parent work with a child on their homework? I mean, isn't that really the responsibility of the teachers and the professionals? I mean, isn't that why we send our children to school for, 7 or 8 hours a day? I mean, is that really the parent's responsibility? And is that the only explanation for why Bobby is having the experience that he has right now? What's the threshold amount of isn't it better that Bobby take self-responsibility to do his homework? Isn't that part of the whole thing here? These are some of the responses that Nancy, rational responses, that she could have written to a should statement here. Here she says Bobby is disorganized and not ready for middle school. Well, disorganization is something that can be changed, right? It's not going to be that hard for Bobby to learn organization. His teacher said he lacks self-confidence and he doesn't follow directions. Here again, this is not an all or nothing type of situation. Nancy doesn't need to overgeneralize and see this as a never-ending pattern of defeat. I'm a bad mother. She's labeled herself here. A good mother spends more time with her children every night. Bobby has been lying and not doing well in school, and it's my fault. Here she is personalizing Bobby's behavior, blaming herself for what Bobby's doing. Bobby's life is ruined. Talk about overgeneralization. He's destined to a miserable life. And of course, it's easy, being an outsider, to see that Nancy is deeply into this distorted view of the world that she is. But Nancy is not aware that she's doing this. And so the first step is for her to learn what these automatic thought distortions are and begin to use some of these techniques to get a more realistic view of the world. The goal here is not really to put on rose-colored glasses, but the goal is to get a more realistic view of the world instead of such a negative perspective. And, this type of therapy has been tested against antidepressant drugs and found to be as effective and sometimes more effective and longer lasting. So, CBT therapy, David Burns' approach, 10 cognitive automatic thought distortions. The goal with CBT is to change the individual's perspective on the world, to get rid of those negative automatic thoughts and replace them with more realistic view of the world, and for the individual to start to behave in such a way that supports a more realistic view of the world as well. Okay, well, that's all I've really got for you right now. That's CBT, Burns' 10 Cognitive Distortions, Ayn Rand's Perspective on the Subconscious, and I'll talk to you later. Bye.